define health and wellness different for everyone because it depends on what your needs are and where you came from, what you learned, what you haven't learned, all of those things. And I think the best way that I can tell you about that is I have a patient. I want to tell you a patient's story. This woman has taught me more about self-care than any school, any education, any other things like that that I've ever listened to or used. And she is now 96 years old, and she's been a patient of mine for about 20 years, probably 20 plus years. In her 30s, she had a medical experience that was very, very negative. And since then, she decided that she was only going to use a holistic care from then on out. So she was in her 30s. And for the next many, many years, she did. And I met her 20 years ago. So she was about in her 50s, I believe. And she never took a drug or an antibiotic and rarely took anything like Tylenol or ibuprofen or things like that. She drove until she was 96 years old. She was as sharp as a tack. She practiced self-care, and she practiced it for anything that her body told her or that she felt was not healing and was wrong. She learned what her body was telling her. She learned whether she needed rest, acupuncture, sleep, herbs. She used herbs and chiropractic. She used acupuncture points that she learned, and she relieved pain. I even worked with her a couple times when she had fallen, and it was just amazing to me because she just used different therapies to heal. And most of them were therapies that she learned on her own from other people, and she just practiced them. So when you ask me, how do I view self-care? I think it's the biggest thing is listening to your body. Listening to what your body's telling you, learn your body, those kinds of things. Unfortunately, in November 2021, this past couple of years, this patient was diagnosed with a terminal heart disease challenge, and hospice came to help her. And I still have seen her, and she still does self-care as much as she can, and she has other holistic treatments that she does. She's very, very tired now, but she laughs because she tells me that she just has to move slower and slower. But she still isn't using any medications, any of those things. She's listening to her body, and her body is slowly passing on. But she's actually very comfortable. She has no pain, and she's okay with how she's moving. The biggest thing that I think is the most important thing is in her last days, and I have no idea how long that is because she always amazes me, she is sending love to her God, to her family, and to her friends. Everyone she can think of. When she passes, it will be with love and grace. If you're wondering, where do I start? How do I help myself? How do I start doing self-care? I can help you. You can book a consultation with me and we can go over your particular situation. Self-care, as I've stated, is probably the most valuable thing that you have as far as your health. So if you need some help, I would love to talk to you and help you design your plan as far as where you need to start.